Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Stevan Walkowski. He's an osteopathic physician. His Kevin MD article is titled From AI to Love, the Key to a Better Future in Medical Education. Stevan, welcome to the show.
Thank you.
We'll get into your article in a little bit, but first off, just briefly share your story and journey to where you are today.
Sure. I'm an osteopathic physician. I'm a graduate from the Ohio School, and my clinical practice is a specialty in OMM and medical acupuncture, osteopathic manipulative medicine, and medical acupuncture. So I have characterized it as minimally invasive pain management. I was medical school faculty since 2007, so I guess I've been doing this about 16 years. Up the ranks to chairman of a department and now an associate dean. So I'm largely in medical school administration.
All right. So as a medical school administrator, what are some current trends that you're seeing regarding the medical school class, applying to medical school? What are some trends that you're seeing?
There are, I guess there are a number. One is from an osteopathic perspective. There are a number of osteopathic schools, new schools that are online to be brought into the mix, and that increases competition. So there is medical school is competitive to get into, and every school wants the top students. And when we have a number of facilities, then we'll all be competing for the same students. So it's really important how we position ourselves. To that same end, one of the things that's always an issue in medical education is what do you do with the students after the second year? So lining up clerkship rotations for the students in their third and fourth year is extremely important. A big issue in terms of medical students per se is making sure that they are professional, and our complaints about professionalism are probably the most significant in our students, and watching them through the first 2 years as well as getting them out into years 3 and 4. So how they behave as professionals, as new physicians, is extremely important.
Now, are you seeing that regarding the professionalism piece? Are you seeing some worrisome trends with these recent incoming medical students?
They don't have a lot of good role models for professionalism, certainly in the media and in the medical media. So TV shows and popular media don't model good professionalism. So modeling yourself after a Scrubs character or House I don't think that lives up to really the standard of the truly honorable profession that medicine can be. As well, there's a documented trend in a decrease in empathy. In the first 2 years, it's about stable, but it drops off precipitously in year 3, 4. So, you could propose a host of reasons why that is, but just recognizing that's a big issue in terms of how people are interacting with patients, and looking at the message boards on social media, it's clear that I feel like there's an alarming trend of students who are, they're struggling. They have a huge debt load. Yeah. And so their emphasis on, specialty and pay and putting that really ahead of everything appears, and it's very concerning from my point.
All right, so let's talk more about your Kevin MD article.
Sure.
We'll talk more about medical education, that intersection with artificial intelligence. Your article is titled From AI to Love, the Key to a Better Future in Medical Education. Now, tell us, how did this article come together?
Yeah, so I think it's probably a huge, long story that encompasses most of my life. But in terms of the moment of how that article came together, it was an intersection of a number of issues. One is that sort of my lifelong commitment to love and interacting in a loving way with the world, and that coupled with a sense that perhaps maybe I was a bit out of my mind in that, and that I was alone, and hearing a podcast by Mark Crowley, who runs a podcast called Lead from the Heart.
Mm-hmm.
And he had somebody on who was a lead designer for PepsiCo, and this man, his name was Mauro Pacini, began to talk about loving your people, and how he was characterized as a unicorn because he really worked from an organizational standpoint with a foundation of love and respect and true concern for his team, and him making a point that was important, and what he had a loving environment, and he had tremendous success in his design team. So that, combined with the issues around medical students and organizational difficulties now post-COVID, and employee engagement, and making sure that we have good morale where we are, and then combining that with a news article in February, it started to get a play in the media, which was the success of ChatGPT in its passing the USMLE, and a recognition that that AI is going to come into medicine, and that there's going to be some adjustments that need to be made, and going back to primacy, and saying, if we're not going to be able to beat AI on an intelligence level, but we can come at medical education, we can come at organizational leadership and development, we can come at medicine from humanistic perspective, from a perspective of greater humanity, and if we start there by actually loving our people, and whether that be our employees or whether that be our medical students, and really from a primary standpoint, coming from that, then perhaps that will lead us to a path where we can bring our humanity to medicine, and that will be an area that AI can never match, because it will never be human.
Now, how are you seeing ChatGPT and other AI tools? How are you seeing that intersect today with medical education?
Right now, it's very early on. It hasn't really, it's just it gotten play in terms of its ability to succeed and match the intelligence, even though it's a language learning model. And I think people are sort of almost apologists in saying, this really isn't medicine. This is just, somebody's just, or not somebody, but the AI is just Googling the information basically that's out there and answering these test questions. So right now, it's not a big player, aside from, but it will be, I think, pretty definitely in areas like radiology and pathology, realms that don't require a lot of human interaction. And I absolutely heard of the use of AI in the future, which I think is coming soon, in terms of fields like oncology, where a tremendous amount of data needs to be assessed and collated, and recognition of what's an effective treatment, and do that very rapidly, and do that with a close eye to the literature, that AI could be a big player in that.
So you said that one of the ways that we could combat AI is that we in medicine, we have to come from a position of love. Now, what are some stories or examples or ways that we can do that?
I think, well, there's, from an osteopathic standpoint, let me just talk about that. We talk about, from an osteopathic, again, manipulative medicine standpoint. So just a brief sort of explanation. Manipulative medicine is the hands-on part of osteopathy. So it was the thing that made us distinctive, and it's a palpatory experience. It's manual diagnosis and treatment. And there are some cases where there's a variety of ways to apply manipulative medicine, but there are some that really require a sense of connectedness to the individual, and and recognition that it is, you bring yourself to the interaction. I think that's what's really unique, is that you bring yourself to that interaction, and the idea that you apply and connect with the patient in a way that recognizes the innate, I know it sounds a little bit bizarre, the innate wisdom of that patient. And recognize that everybody brings their personality, and some people have a lot of trauma that they bring to an interaction, but that there is within us that sense of innate wisdom and allowing for that connectivity. And it's a very vulnerable position. It's very heart-centered. And to bring that to the interaction, you're increasing what you do. Another situation, and this is as a medical student, I brought this into my article, is that, very simply, I just remember sitting with somebody who had a melanoma recurrence, and this was many years ago, and just knowing that, in some cases there's not a lot one can do, and in this case, this individual was, he was not going to survive, but to just be with him and just to be present, and the recognition that we're all just human beings on the planet, and we're all, we all do better if we join together in this. And just simply being present with him in that moment was, about as healing as it could be for him.
Now, how do you teach your medical students this approach? Because as you said earlier, sometimes there's an empathy gap. They're certainly concerned about the debt load. Now you have the infiltration of machines and AI. What are some specific ways that you're teaching medical students to maintain this humanity in that doctor-patient relationship?
That's a great question. It's not something that you can teach. It's something that you can learn, but it really requires modeling. So, one has to model that behavior. People have to feel loved in order to behave from that standpoint. I mean, there are many, many forces working against that, and in many ways, I can't say, okay, now practice this way. I mean, we have, pieces within the college where we're, allowing for mindfulness, and we teach physician self-care, and, trying to combat the sort of epidemic of physician burnout. But really, it's a modeling behavior. I mean, students know when people care about them, and we need to care about our faculty and make sure that they understand that they're appreciated, so that they can communicate this as well.
We're talking to Stevan Walkowski. He's an osteopathic physician. His Kevin MD article is titled "From AI to Love: The Key to a Better Future in Medical Education." So, Stevan, what do you see as the future as AI becomes more, I would say, knowledgeable, more prevalent? How do you see AI intersecting with medical education going forward?
Yeah, I think that the possibility is that, I guess in a perfect world, there might be the opportunity to use AI to our advantage, really, so that we're not so bogged down with the particulars of EHR, and we can do it in a way that is streamlined. We can, there was the Blue Ribbon Commission some years ago, basically touted how we would be using advanced practice providers and PAs and NPs as physicians and supervising that work. And so the physicians would work sort of at the top of their degree. And AI probably will have some role to play in that. But the important thing, is, for me, is to recognize that it will only be us as individuals to bring our humanity to that interaction. So it can help us to make decisions better, perhaps, but it will be that bringing ourselves to the interaction that will continue helping patients to feel loved.
And my final question, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Shout it from the rooftops. Love is the most powerful force in the universe. And, with keeping your heart open and staying vulnerable and connecting with individuals, we really can move mountains. And to love your people, whether that be your patients, your staff, your faculty. Absolutely, bring yourself to the interaction. Don't be afraid of it. Don't be afraid of love. We treat love as a non-renewable resource often. We're afraid to talk about it or reserve it. We're only reserve it for our spouses or our very, very, very close friends or our family. But love is something that we can share, and it will continue to move through us. It's not going to go away if we spread it around.
Stevan, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thanks, Kevin.